Today we're going to demonstrate the appropriate technique for injection of the knee. In this case, we're going to use the lateral infrapatellar approach. The patient is seated with the knee flexed in 90 degrees. The indication for the procedure is osteoarthritis of the knee, Kelvin-Lawrence grade 2 in her case. We're going to explain to the patient all the benefits and side effects for the medication we're using today, and that has already been done and reviewed with the patient. And she has consented accordingly for the procedure. So aseptic techniques are used for this purpose, but first we're going to identify the landmarks that we're going to use for injecting the medication. So we identify the patella. Afterwards, we identify the patellar tendon and the tibial plateau. The medication is going to be injected 1 centimeter laterally to the patellar tendon and 1 centimeter superior to the tibial plateau. So we mark our site of injection. After marking our site, we place our gloves and we prep the site for injection. For this, we can use either iodine or alcohol. In this case, we're going to use alcohol. Afterwards, we're going to provide her with the topical anesthetic. In this case, it's going to be ethyl chloride. We're going to spray directly towards the area to be injected for around 5 seconds at a distance of approximately 6 inches. After that is done, we're going to get our injection, which contains a needle. It's an actual 22 gauge needle, 1.5 inch, containing the material and the medication to be injected. In this case, it is a total volume of 4.2 ml, containing 2.2 ml of Tramil and 2.0 ml of seal. So the needle is directed perpendicularly towards the area marked for the injection. Perfect. We drain a little bit. All the fluid has to be drained from this side to be injected, and arthrocentesis drain all the fluid before giving the injection. And afterwards, the injection is provided accordingly. If you feel any pressure or resistance, the needle is redirected accordingly. So after the injection has been placed, we use a gauze and apply pressure to the area injected. We then use alcohol to remove any material that has remained inside, either the iodine or the alcohol that we have used, and we place a Band-Aid. The patient is instructed about post-procedure recommendations, which includes avoiding vigorous activities for the day of the injection for at least 24 hours. She can also use ice packs for a total length of 15 to 20 minutes, for today and tomorrow after the procedure. And she can resume her regular activities afterwards after the 48 hours. In addition, she should expect a benefit and improvement in her symptoms within 1 week of the injection, with further benefits to be observed on the 2nd and 3rd week after the injection has been placed. A follow-up appointment will be given to her, so she comes and we do a clinical assessment of her response to the treatment given. In this case, we're going to use the medial superior approach for the injection. The patient is placed supine with the knee extended. It can also be flexed to around 50 to 20 degrees. In this case, it's going to be fully extended. So first, we identify the landmarks for the procedure. In this case, it is the medial approach. So we identify the patella, and we look to the upper third aspect of the patella, and we're going to inject medially in the superior third of the patella. We looked for the lateral edge of the patella, and the injection is going to be directing the needle behind the patella towards the intercondylar notch. So after marking our spot, we prep the site to be injected. We use aseptic techniques for the procedure. We use gloves, and we prep the site with either iodine or alcohol. In this case, we're going to use alcohol. So afterwards, we use a topical anesthetic. We're going to use ethyl chloride. We're going to spray at around 6 inches for a total of around 5 to 6 seconds. The material or the injection that we're going to use today is going to use a total volume of approximately, 4.2 ml. It is going to be Tromeo 2.2 ml and Zeal 2 ml. So total amount to be injected 4.2. So identify the site, and we use a 22 gauge 1.5 inch needle and direct it towards the site that we have identified. Okay, we always try to drain to see if we can actually get fluid. All the fluid has to be drained prior to the injection of our medication. Then the medication is given appropriately. So after the injection is placed, we apply pressure with a gauze. We remove any excess of the prep material that we have used. And we place a Band-Aid. The patient is instructed about the appropriate post-procedure precautions. She is to avoid vigorous activity for around 24 hours. She may place ice packs to the area injected within the 24-48 hours after the injection, usually for around 15 minutes each time. She should expect a benefit and an improvement in her symptoms within the first week. More improvement is expected towards the second and third week of therapy. So afterwards, we are going to schedule a follow-up for her in 1 week for further injections.